speak on his amendment.
Mr. Chairman, thank you so much. More than 30 million Americans across this country are living with a rare disease or disorder, and more than 93% of the 7,000 rare diseases still have no FDA-approved treatment. Some of you have family members with a rare disease, so you know the pain they face every day and the hope they have in spite of everything. Many of you in your offices have had so many come by your offices to talk about what their diseases are and to ask for our help. And if you've never heard of spina bifida, it's a rare condition, usually detectable in the womb, that affects the spine. During development of the spine, a neural tube doesn't close all the way, preventing the backbone from developing as it's supposed to. And this causes damage to the spinal cord and nerves. Spina bifida can result in both physical and intellectual disabilities, and many babies who are born with spina bifida don't live long. I had a sister who was born with spina bifida who died 2 hours before she was born. After she was born. If she survived, she would be about 13 months older than I am today. And it was then that my mother learned that she had a gene that would affect her future children. And in spite of that prognosis, my mom continued to have children, including myself and a brother who were born without spina bifida. My sister, who turned 52 earlier this year, was born with spina bifida, and she spent the first 6 months of her life in a hospital. My sister went on to live a full life in spite of her condition, and she has a daughter, Kristen, who was also born with spina bifida. Kristen is now 32 and has spent her entire life in a wheelchair. I've spent my life face to face with the realities of living with a rare disease that has no cure. I'd give anything to lessen their pain. And when I talk about the need to prioritize research and development of cures and treatments for rare diseases, it's not a Republican talking point. It's not even a political talking point. It's the hope and prayer of my sister, my niece, and every one of the 70,000 Americans living with spina bifida. The partisan proposal before us today, which we received a few days ago, and proposes a government takeover of prescription drug pricing, which makes America more reliant on China and fewer cures available and medical breakthroughs less likely. The nonpartisan CBO projects that this bill will lead to the development of fewer cures. Why are we passing legislation that the CBO, who we all rely on, says will result in less investment in research and development? People are still dying from COVID. Have we not learned anything? We all agree the increasing cost of drugs is unacceptable. Let's work together to find solutions that make drugs more affordable and much more widely available, not less. Please, let's work together. This isn't partisan. The Democrat Party isn't even together on this. As we speak, there's a group of Democrats working on a different price control bill because they see this one is unacceptable. It's 5 members, by the way, which are more than covers the margin of error you have in the full House that's needed to pass this bill. My amendment today gives hope to the many Americans struggling to fight the rare diseases by exempting cures for rare diseases and disorders from government price controls, which will incentivize the research and development for new cures. It's critical that this committee consider those living without approved treatments, like my sister and my niece, and so many others. Now is not the time to push policies that reduce rare disease research and development. Mr. Chairman, can I insert for the record letters from the National Organization for Rare Disorders,
So ordered.
NORD, and Every Life Foundation for Rare Diseases?
So ordered.
2 documents. Thank you. Just in closing on this, and I know we're fighting over a lot of things, but this is about humans. This isn't about how much money we're talking about for each individual. We're talking about saving lives. So much criticism has been given by both sides about being pro-life, taking care of babies after life. That's what this is about. This is about what Democrats have always been critical of Republicans, if we want to make this political, which I don't. I've only been in politics for a little over 2 years. But I'm one, as I've said in this amendment, that wants to help those who have been born with rare diseases that we need to help together. And I truly, truly ask you for your support on my amendment. Mr. Chairman, yield back.
I thank the